Your Excellency, it's great to see you here at the Abu Dhabi Healthcare Week, the inaugural event for Abu Dhabi. What in your mind are some of the key challenges for healthcare today? Because the conversation we're having here is about making this about health and less about healthcare.
So I think that's really the key challenge, this transition from healthcare to health. It needs a change of mindset as well, not only from political leadership, but also to populations themselves, that there is an element to healthcare that is within your control if you change some of the things that you currently do. So I think that's fundamental to this transition from healthcare to health. And the second is related. It's got to do with leadership. You must invest in health in places where you may not think it's necessary. If you invest, for instance, in IT infrastructure, you're really investing in health, because you look at how these digital transformations are going to change healthcare in itself. But if your IT infrastructure is lagging, you're not going to keep up with these changes. So there's a lot of multi-sectoral changes that will need to happen, that will shape these mega trends that we're talking about, utilizing technology and AI. All of them rely on multi-sectoral investment.
It's interesting that here in Abu Dhabi, a place that's really been for so many years an incubator across multiple sectors, one of the things that hasn't been talked about is women's health. In your mind, how essential is it to get to the core of health for women?
It's absolutely critical, because generally health and the health of a family is gendered. It really relies on the woman's health to make sure that the family is healthy. But when you look at the trends, and I'm talking probably from an African perspective, and you mentioned it as well, if there's a specific demographic whose health is neglected and whose general needs are neglected, it is both women and children. When you look at the HIV response, children were left behind. But in the same response, you'll notice that women are the biggest uptakers of available healthcare. But generally, it's not targeted enough, and there isn't enough investment in female-specific interventions. And that lies in the heart of this. I think this is our opportunity as we transition from healthcare to health, to make sure that women and children are not left behind.
And this is something that speaks to the leadership element of all of this. When you look at a gathering like this, and many of them are responsible for bringing a lot of these drugs to market, talk to me a little bit about that ecosystem and where it's falling short.
We knew about it, we talked about it, but we saw it during COVID-19. And you've got different takes on this, but ultimately, I come from a country, Namibia, where we had money, for instance, to buy vaccines, but there was a lot of inequity in how accessibility was determined. We're in Abu Dhabi at the moment, and there's enough money, but you may not have the technological know-how. So money isn't always the solution. We must have these difficult conversations about flexibility around intellectual capital, around waivers, around the transfer of technological know-how. And if we don't have these conversations, we will forever be stuck in conversations where either countries can't afford it, or the ones who can't access it. So access and affordability remains critical to this conversation. And it's happening at a time where I think global solidarity is at an all-time low. It's a lack of trust, but I think there's also a lack of respect of enabling people and allowing people to become self-sufficient. Why should a country that has the financial resources not be able to access the technological know-how? We're told that we, for instance, don't do enough production on the continent. South Africa has an mRNA facility that can't be used because nobody's willing to share technology. That was the same incident that happened in Kenya with a very specific pharmaceutical company. And I think if we're not learning the lessons, we're not going to get from healthcare to health with so much inequity, both from a political and a financial perspective. So it's private sector as well as big Western countries.
How do you see the UAE becoming a conduit for this, not just the technology aspect, but the logistics as well, because obviously we're sitting here at frankly the cornerstone of East and West. And we saw in 2023 when they hosted COP28 that there was a renewed emphasis, and perhaps an emphasis we hadn't even seen before, on talking to the global South and listening to what they had to say. So how important in your mind is this country to that transition?
I think it's critical to that transition. The fact that we're having this conversation from healthcare to health, it takes a place like the UAE to take leadership and say, we'll invest in this because we can afford to. And a lot of the technologies, I think from a technological perspective, where you have these startups and you can incubate and you can and develop, it means you can also scale up. Once you scale up, it becomes affordable. And so others can start utilizing the technology that's developed in countries like the UAE at a much cheaper perspective. So I think it's the type of leadership we need. And at the end of the day, I think developing countries are to an extent, they're on their own. So I think the UAE can play a critical role in enabling an environment that can be scaled up and other countries can leverage from the investments that they make in technological know-how, capacity building, innovation, and technology.
Your Excellency, it's great to have you here at Abu Dhabi Healthcare Week. Thank you so much for joining us.
Thank you very much.